Hello again, everyone. I hope you have enjoyed the first parallel session this morning and you have enjoyed the lunch. I am excited to welcome you to the first plenary session of EHMA 2025. And this session, as you may know, is titled From Reactive to Proactive, Shaping Future Health Systems. I would like to introduce you the facilitator of the plenary session, Professor Federico Lega. I told you he is the only one guy on the stage. And he is professor in healthcare management at the University of Milano, Italy. Federico, the floor is yours.
What a lucky guy I am in such a good company, I'd rather say. So I don't know whether it's good morning, good afternoon, but at this point, actually, welcome to this plenary session. A few words just to introduce the session itself and the topics which has a lot to do with sustainability and how can we and why we have to turn a health system from being reactive to proactive in order to increase the chance that we have sustainable health system, health organization. In my view, we live in what I would call the third wave of disruptive transformation and revolution of health system. I think we all agree we have a first major wave after the Second World War when we started to being serious about creating health system which were able to provide universal coverage, or at least will try to provide universal coverage and access to basic care for all. And that was a major effort back in the 50s and the 60s for many systems. Not all the systems actually were successful, but that was certainly a striking point in the evolution of the way we conceive a system. Then we had the second wave in the 90s, which was referring many systems to what we call the managerialization of healthcare or the corporatization of health organization, right? We were very much worried about efficiency at that time. We thought actually sustainability was basically a result of a more efficient way of delivering the services. So we strengthened the focus on cost control and on operations after. And at the same time, we also, as a response to the obviously criticism that all this actually effort in managerialization and corporatization generate in the clinical environment, we developed a second thought, which was labeled the clinical governance approach, in which we try to see the efficiency from a different perspective, which was how we can standardize clinical pathways and the way physicians and clinicians deliver the care. But it was still efficiency, actually, what was dominant in most cases. And if you look at the performance measure that we use at that time, and we still use in many circumstances, that reflect that approaches, right? Because we measure volumes, we measure financial results, and not much else, rather say. Then when we said there's something more that we need to do, this actually is not giving us sustainable system for the future, and we come to the current times. And now I think we are right in the midst of a third wave. This third wave actually requires a new framing of the way we conceive the concept itself of delivering health services. And from reactive to proactive is basically the key concept of this new framing that we have in mind, from caring and curing to maintaining the population in health. Okay? We're turning the system to being caring and curing system to being system, we're trying actually to be a system which actually help people to stay healthy rather than taking care of them when they get unhealthy. which is a big revolution, which means that we still have to have in place a system delivering our services, but at the same time, we need the system to do a sort of a U-turn and say that the problem is investing resources in all the activities which are not generating our services, but are actually avoiding the fact that we need to deliver our services. And that's why we're talking about population health management rather than health service management. That's why we're talking about concordance rather than compliance, because we also want a more human system, which is really put the person at the center stage rather than the patient. So there are some consequences of this, obviously, right? Because if you look at the challenges that we have in order to make sustainable this approach and making the system able to be successful in this quest, we need to generate more integrated delivery system, primary, secondary, tertiary, rehabilitations, prevention. So, and that's certainly something that is central to many of the strategic agenda of a health system, but is still very much a problem for many fragmented systems. Then we have also the addition of turning system from being centered on person to be more centered on the comprehensive chain of services, which might also impact of the human well-being. And so we're talking about One Health, and we're starting to say we need to integrate also on a different perspective rather than just within the health system, also with the other system. Then we started to say that we need to measure different things. It's nothing new, but actually we're becoming finally serious about this, and we started to say, okay, we need volumes, we need financial sustainability, but we need also a lot of much more attention to outcomes and what actually we really generate in terms of value for our health system. And I think the title of the conference this year really reflects very, very well this new approach, or rather say this increasingly dominating mindset within health systems. So taking action to improve health for all is really what we should do. And many other things actually will be involved into that. The better ways of introducing new technology. We're becoming much more serious in doing health technology assessment and making sure that we choose the right things for the right problem, and we put it in the right place within the system. But also we need to obviously invest much more resources in areas that were substantially neglected or cannibalized by other levels of care. I'm talking about preventions and health education, which in many systems are still very much in the back stage of the money spent by the system itself. So I think it's clear to all of us that, I mean, from my perspective, we're really in a new phase for many a system in which we are changing the dominant paradigm, the dominant mindset that for almost a century drive us to the type of a system that we have today, and that's also have implication when we look at sustainability, and that's what we're going to talk about with the honorable guest speakers that I have here with me today. And sustainability is taking new meanings because we had in mind the financial sustainability as the major issues of the 90s, but now we're talking about environmental sustainability, and we're going to have a focus on that. We're talking about organizational sustainability, which means generating places where people actually can find the right context in which they can flourish in terms of developing their competences, and might also organizational sustainability has to do with multidisciplinarity, multi-professional, with generating new organizations which break the silos and works in different ways. But we also have a matter of personal sustainability, because people want to have a good work-life balance. People, the new generation especially, are bringing new values within the organization. So we need to think in different ways. And that obviously brings to the last point of my introduction, is that we need a different type of leadership in this new environment in which we live today in our system. We need really to step up and have leaders which are able to understand that the challenge that they face is not making their health services more efficient or increase volumes, but it's really changing the way we look at things and bringing new perspectives and making sure that they're able also to interact with the policymakers on a different level to make things happen. So we have all this in a context which is quite hostile, because if I look at the unprecedented intrinsic challenges that we face, workforce crisis, technology revolution, system-wide technology revolution, not clinical technology. We're talking about how artificial intelligence, robotics, and automatization will change forever the way we work, and the increase of expectations at all levels. So that's the challenge for you, to help us to understand what we need to do in order to be more effective to cope with this context. And I will leave the floor now to Charlotte Marchandis, which is the director of EUFA, and I'm very happy to listen to you. Charlotte, please.
Thank you very much. Very happy to be here. It's also kind of home because I'm from Rennes. Used to be deputy mayor of the city, and I worked a lot with this school in interventional research that led me to EUFA. So, easy. I mean, we're talking about waves. We are in these waves. You are here. I won't get you through all the crises we are facing. This is not the health system crisis, this is a global crisis, but health systems are at the core of it. They are the ones that are able to react or not. We've seen that in Ukraine, we've seen that in Valencia or in Nîmes recently with the floods. We know that they've been in Spain when they had this apagón, this big, Spain and Portugal, cut off electricity. They're here also to answer lots of questions of the population. And we are here there as managers trying to figure out how we deal with the workforce crisis, but also the underfunding of public health. We are currently protesting, lots of us here were talking about that before, about the Commission cutting funds to NGO. We have a political crisis, and if health is a political choice, I can tell you it's not the choice they're making now. So we are constantly changing, and how do we do? How do we manage that? How do we sleep? How do we feel okay with that? I don't know what is, if something is keeping you from sleeping. For me, for instance, AMR, antimicrobial resistance, is one of my top 3 insomnia topic. We all have that, and all your teams have that, your students have that. We are in this crisis, and yes, we need new competencies. How do we do that? So you are here. I don't want to make you cry, hopefully. You will be learning at this conference, but we don't come to conferences only to learn. We come to conferences to connect. We've been doing with Scott, I don't know where we are, we dealt with something in 5 minutes around a coffee that would have taken several emails. So I'm happy to have an email less. We have no choice but to act, but we cannot act the same way we did. Dancing is a good way of doing it, but how do we say that we train and we manage as change agent? So we need to build trust, but across sectors. Health is 10%, 12, 15% healthcare system, the rest is society. Change is good, but how do you get your team to change? Theory of change is something people don't want to change. Well, at least they don't want to be changed. So how do you do that? You need to enable others. We cannot do that alone. And this is really the main point of my talk. You cannot do that alone. None of us can. The first thing I did when I arrived in EUFA 1 and something year ago was to create message groups with the other directors of NGOs, having co-development, being able to call Federica, I've got a huge problem, let's talk about it. because it's where we can find help, where we can find other solution, where she can tell me, well, I found a solution for that, here it is. I wrote a new paper for my team, use it. Or I tried something, it didn't work, because we need to learn about failure. We're not here to brag about successes. We're here to share the conditions of the success or the conditions of the failure, so we can learn from each other. So how do we have a vision, but how do we translate it into actions, and how do we not spare time to reinvent the wheel, which is something we do a lot. We do a lot of inventing our own personal way of doing it when others have it. I really think we should be more cooperative and creating common goods. We do not need to do all of us the same work on Charter of Equity or redefining the essential public health function in a new way when ASFER and WHO already did it. So let's really use what is there. When it comes to public health, I'm always back to Ottawa Charter. Everything is there. Let's not do a new charter. We have Ottawa Charter. So your change agent, how do you translate into action? Well, that's easy. That's you too. You have to go across disciplines with your team. Health in all, health for all policy. You've got to know about data and management and community work, participation, but you have to do meaningful participation, because participation, if they just have to choose the color of the hospital, doesn't work. And you need to know about politics and policy. You need to know your mayor, your regional director. You need to know your member of European Parliament, and all the debates happening in the trilogue between Council, Commission, and Parliament. You need to know about environment, urban planning, transport, accessibility, education, and so on. Doing things with the people, it takes competency, it takes training. We need to train each other, but you will have a better policy. You will have a better design if you build your health system with your team, of course, but also the patients and the communities around. And there are amazing examples where hospitals are not something apart from the city, but embedded in the cities, where healthcare facilities are embedded with communities. And this is a way of using the same resources. So for instance, in Rennes, we worked a lot. They were changing the mental health hospital. We worked a lot in seeing what kind of places, facilities we can share with the city. So for instance, when the kids are in hospital, they just need it for the day, but they need playground for the kids in the hospital. But the evening or weekends, they don't use it. Children of the neighborhood can use them. Let's think it differently. And if you are in the neighborhood, we've been doing lots of thinking here. How can we get people to cross this whole hospital and environment place with a feeling of belonging? Right now, it's not working that much. I mean, there's an amazing new house where you can give your blood. They're announcing it in the metro, but try to find it. Really hard. So how can you do that, and how can you do that with others? And actually, when you have the good techniques, it's actually less work for you. If we want health facilities to be civic spaces, it's also because, for me, at least, public health is about democracy, and democracy is also it's also an important topic where to include health, especially when now we are all talking about defense, preparedness, security. The democratic shield is in danger, in my point of view. Public health is a great way to go back into that. Public health as equity, public health as in empowerment, public health as in human rights. If we say that hospitals are safe, green, healthy spaces, if we say that hospital will allow leading by example, first with their team, social sustainability, and places where community gather, then we can recreate trust. You will not ever create trust just talking in between each other. We cannot do that. It doesn't work. If we just talk in a bubble, whether it's manager, whether it's academic, whether it's politician, nothing will change. And lots of time is about knowing each other's vocabulary, but when you do that, it works. Those are images of a hospital in Singapore where everything is thought about the city. So all the roofs are green, and it's for protecting, and we'll talk about that later. But it's also somewhere where the elder community of the neighborhood are growing fruits and vegetables. There are lots of things, I won't go into detail. This is inspiring. We can't go from there because they have ideas I've never seen before in anywhere else. Resilience, it's infrastructure. We have to go for infrastructure, it's a fact, but it's also about trust. It's about individual coping, but it's about collective capacity. It's about saying, I don't know. Help me. Let's find a solution together. And sometimes as manager, we want to know everything. I'm okay. As a politician, I said often, I don't know. I don't need to know everything. Collective capacity is good. How do we create space for new voices, new methods, new relationships? And we will start to do it here, but we cannot wait for next conference to say this is what happened. We cannot say, oh, the conference was great, but then next week I have another same problem on the big wave coming. So my proposition is that we build the living network now, and that you start creating chat groups, and that you share successes and failure, the condition that made them happen, share what works, and create common goods, co-owning what's next. So instead of making a upload, you have 5 minutes to think about what kind of name the group you want. You have a great app to use, and let's make something. Let's see how the impact of the conference is not only on the moment, but is long-lasting. How can we build something? And we are truly committed with EHMA and UFA to build upon it, to build things that are long-lasting and that we share, and that we do and come back to you, because it is accountability. Last but not least, don't forget to protest, because if we want funding for public health, if we block Brussels with health tractors, it will work better. Yeah, and we don't do it. We don't protest. We don't sign petitions. We are low voices. If we want the money, we have to block the city. Sorry for that. Thank you.
Prova.
All right, thank you very much, Charlotte, for your introduction. And now we're going to start some conversation with our guests. We have, starting from left to right, Nathalie Alliou, which is the medical director of Fundació Sanitaria Mollet, which is an hospital, right? Yes. By the end of the day, Spain. We have Caroline Sander, which is the chief executive officer of the Danderyds Hospital in Stockholm regions, Sweden. And then we have Silvia Gabriela Cinte, which is the deputy general manager of the National Institute of Health Service Management in Bucharest, Romania. So I will start from Natalia, and Charlotte was saying there are some things that don't make me sleep, right? Keep me awake at night. So the question to you is, there's certainly something that keeps you awake, and I know that relates also to sustainability, and especially to a work that you've been doing a lot on creating, she was saying before, safer, healthy, more social, more sustainable from the also environmental viewpoint hospital. So can you just share with us what is the take-home lesson from your experience?
Okay. First of all, introduce a little bit myself. I'm the medical director of it's a little hospital located in the metropolitan area of the city of Barcelona. It's a green hospital. That means that we are a net zero hospital. We are neutral in footprint, in carbon footprint. So that was our main project developed in the past years. We start creating a new hospital in 2010, and it starts from the paper. Wanted to develop that where we are now. So we had this insomnia in the past, and how to draw a new hospital, how to become a green hospital. When we present all the green hospital project, we talk mainly in 4 points. You have it in the slide, from structure, processes, culture, and governance. I think the first of all is the governance. If our CEO hasn't believed on that, it wouldn't be able to develop where we are now. So it's really important to create a strategic plan, a route to achieve a net zero total. So it was really important at first, because all the things developed from that moment in 2010 when we started the hospital became from that, because there was investment, there was a strategic plan. Every one of us has a project, a personal project related to sustainability, and it was easy. It wasn't easy because we have a director of sustainability, but it's not only in his job. All of us, we have objectives related to sustainability. So every department of the institution is related to that. So it's top down, but the other point that I'm going to talk about is how to do also bottom up. If you the next one, thank you. How to become a green hospital project is about leadership and also how to create this culture of sustainability, because it's not only in the paper. We have a lot of research where you all know that the clinical sector and the health sector is really contaminant. We are like the 5 most polluting, the most polluting sector in the world. If we were a country, we were the 5 most polluting countries. So it's very, very important to take care of that. And we start a strategic plan to achieve that project and also to work on sustainability. We are given sustainability training to all the workers of our institution from the first day to start that culture. And all the projects who are from little to big ones. The big ones is like photovoltaic cover, but the little ones is to take away all the bottles of water to the plastic waters. We also have glass in all the hospital. So these little things became from the bottom of the institution, and this is how we achieve, because at first we have a marvelous structure. You can see it in the pictures. We have natural light, we have geothermia, we have covered radiant, we have light, natural light in all the hospital. It was the first step, and it was really easy to develop, because we have to create a new hospital, and we start, as I said, from the draw, creating that. But the culture and how we develop it in the processes, from clinical meetings. If I get in a meeting with all the surgical process, we talk about sustainability. If we are in a meeting with, if we have to buy something, there's also the director of sustainability in the table. So it's how we get that net zero. Because the first step was easy with the structure, but how to get the culture and how to expand it, it was the difficult thing. Here you can see some of the improvements we have been developed with that methodology. It's an example of how we get from the theory, from the more academic world of that necessary of a change, and how to improve it and do it, because we try it, and some projects they doesn't work and we left them, but these are the examples that are more exitous. All right. Do you want to explain more?
No.
I can develop.
I thought you were waiting
them.
for another slide, so I was just
it wasn't.
so impressive the presentation. I was waiting for the next one. I couldn't wait for. All right, I'll come back to you with a couple of questions after, nice. But environmental sustainability, and I love the net zero. That's actually, it becomes a sort of an identity, right, for your hospital.
Yes.
And a sense, and increase the sense of belongingness, right? So I really think actually something which we need to reflect, that we generate within hospital that kind of belongingness and identity, especially if you have, if I understood well, a medium-sized hospital, not a large one, not a teaching one, not actually which one will already have a brand or reputation by itself, and you need to create something that make attractive for the physicians and for the nurses to work for that specific place. So that's an important conversation we're going to have later. I will now ask Caroline if you can share with us your dreams, rather say, but also the reality of what you're doing in Stockholm. You can use the other one.
I'll do like this. You can hear me. Yeah, that's good. Well, I think that waste, it's my insomnia. And what have we done in Stockholm, Sweden? Actually, we have been struggling for years. I can admit that. We have been struggling after COVID. We are struggling and have been struggling with our financial situation. And we also have this sense of constant lack of staff. And I don't know, maybe you can relate to this. Actually, we found that this struggling and, we didn't coordinate us well enough. So it led to decreased availability for our patients. And when we analyzed this, the queues, the patients waiting in the ER, the patients waiting for surgery, first doctor's appointment, and so forth, we analyzed and we learned that this is a large misuse of resources, actually, because it takes a lot of staff to take care of all those patients that are waiting. So we tried for some years and to build up something new. And I want to show you some results that we have achieved in the region of Stockholm. And as you can see here is a kind of a structural approach to plan the production and the capacity, and also the right sizing of the staff. That was kind of a new approach for us, because we came from a system that we usually thought, I have so many nurses here and there and so many doctors, which means that I can, take care of so many patients, and that wasn't really good enough often. So we turned this the other way around and tried to adjust our capacity after the patient's needs. And it's also really important to coordinate. We have to coordinate this capacity between units and actually now in Stockholm also between hospitals. We have learned so much. We help each other. We don't compete with each other. We try to help each other. Trying to look at the waiting list to surgery, for example, as one waiting list, and we try to help when somebody has a capacity problem. This is really also a data-driven approach. It doesn't mean that we don't talk about feelings, and I really like this about building trust. You cannot do like this if you're not trustworthy. But we have this data-driven approach, so we calculate the capacity. We look at our historical data and also that the patients that we will have to care for in the future. So it's much a data-driven approach. Beep, yes. And this is the essential, actually. It's all the resources that are coordinated will be used effectively. And go back. Yes, sorry. And this could be, you could see this as, a patient flow within one hospital. For example, if you're supposed to get bowel surgery and you don't have a bed in the ward is missing. Everybody would have come that day to the operating theaters in vain. They won't have the patient done. So I think there's a lot of value in this. Try to coordinate our resources. And now comes the result. This is we started a couple of years ago, and this is the improvement during the last 18 months. This is actually the number of patients waiting in the region of Stockholm. The pink ones, they have waited more than 90 days, and the government tells us that we're supposed to offer them surgery within 90 days, not cancer and so on. They have other, time slots, but this is for surgery that can wait, hip replacement surgery, for example. And then you can see the blue ones. They are waiting, but they haven't, exceeded 90 days. And you can see here that we have gone from 67% to 80% that gets their operation in time since we measured last time, 18 months ago. And that is actually the mark, the goal that the government gave us. So we're going to continue to work like this in a data-driven approach, try to reduce the waste, try to use the resources that we have, and also a lot of cooperation between hospitals. Thank you.
Thank you, Caroline, for this overview of how important can be having operation in place and how much space we still can recover in terms of productivity within our system. Even when we think actually we already reach the maximum level, then you go deep and you see that there are still places. We're gonna then challenge you, how do you actually make that happen in reality? No, later, you just prepare for that so you have time. Because one of the things that we have in our organization is, we call it retention of solutions. So the fact that most of the organizations try to solve problems with their past-minded approaches rather than exploring alternatives. So how did you contaminate or generate new views in your system? Same, obviously, in the case of environmental sustainability. But we come to you, Silvia Gabriela. We've already been talking about the importance of leadership and how much systems require resilient and robust leaders able also to generate the new visions. So if you can tell us the work that you've been doing in your system, which actually it is a system in transition to many extent, where managerialization is now becoming a reality, or is an aspiration of the system itself, and you're really focal point in that. So how can you make that kind of transformation within the system from your perspective?
First of all, I would like, if you're allowed, to tell that having good managers and good management capacity, it helps not only for the change to happen, but also it helps for the new system to operate, and also some of the decisions should be taken for the future. And I have in mind this commercial on Romanian television in which a man is painting his walls and suddenly receives a visit from someone who says, "Hello, I am you from the future, and I came to congratulate you that you have chosen this brand. So our walls looks like freshly painted after 30 years. So I think this is when we think about training new managers, to train persons not to solve the current solutions, but to be able to take the best solutions for what is expecting us in the future, because we have so many challenges. We haven't been trained before to solve them, and we need, as you said, a new mind, not the old one. So we embarked on the reform in the 90s, and I think it was a good start, because in all the Europe, you said it was the stage of management improving process. We didn't have management before because until the communists fall, because in the previous system you had the central power and no decision needed to be taken in the field. So in 90s we started training managers as part of public health curricula, and this was a new discipline created from the so-called social medicine. The colleagues from Eastern and Southeastern Europe know what I'm talking about. And also through a World Bank project, we created a school of management. But still until 2006, there was no requirement for a health manager to fill a position having a special training. So only after 2006 we started training more managers in Romania because they needed to be trained. In the meantime, we improved the curricula with different modules, but after the pandemics, analyzing the performances of the system, we realized that the system was not able to deal with the new challenge, to absorb the shock, and to go on without problems. So we thought that management is so important as any other resource, essential resource for a reform. You need political will, you need finances, you need experts in the field of the reform, but mainly you need good managers to help you to implement the changes. So we took advantage of this European instrument, resilience and recovery facility. And under the WHO technical assistance, we beneficiated by the expertise of great experts in EHMA, Nova School of Portugal, IES from Barcelona, and University from Milano, and they made an analysis of the existence of existent public health and health services management programs, and with their help we improved our teaching curricula. But not only teaching curricula, we improved our way of teaching, and we took out from the class, so to say, our students, because we also organized, also with our friends, no longer than last week, we had a workshop with colleagues from Rennes, from l'École des Hautes Études en Santé Publique, for new models of financing. We also invite our hospital directors that already implemented change to our courses. We changed also our way of transmitting the information, and we go very much on teaching from examples, involving other colleagues, because as Professor Isabelle Richard said in the opening, health is not a commercial field. So we don't have to compete between ourselves, we have to collaborate and to make better health for our people in every country. So in 5 minutes, this is what I can tell. Maybe I can tell more if you...
Yes, certainly. Round of applause for that. We'll come back also to your point, because one of the things that I want to discuss here is if the challenge is preparing the next cohort of leaders to be able to contribute to the building of the future, how do you train them what specifically actually should be the target. But I'll come back to you later. Charlotte, you're going to be the last. No, I'm going to keep you for the last 15 minutes to provide comments because, yes, because you also represent an association which has a role in actually in shaping the future of a health system across Europe. So I want to keep you for the last review. I'll come back to Natalia. Natalia, if I'm using my perspective, what really strikes me in your experience is the fact that addressing an issue which, from common sense, would say you have to do it. You have to generate environmental sustainability within your hospital. You really create an opportunity to generate what I call a collective ambition within your hospital, and that collective ambition is what really motivates people, and then everything actually moves one step higher, and everyone is more engaged. So what I want to ask you is, how did you create a collective ambition? How did you engage the governance of the hospital? How did it start? If any of the hospital of the people actually represented here in the audience want to do the same path, where do you start from?
The first thing was to create a sustainability committee. There were not all the heads of departments.
Sustainability committee, you say?
Committee, we have a group of work.
Who was sitting in the sustainability committee?
I was telling that they were not all head of department. Some of them, they are. For example, the person who developed all the project in the Green Lab, she is the head of department in the laboratory. But the other are people sensitive to that objective. We explain it. It was like an open list. If you want to achieve, to connect with us, come to us. And finally,
it was an open call.
It was an open call, yes, for all the processes. And we finally identified one person for all the huge clinical processes. One for surgical, one for hospitalization, one for virtual care. All the framework of the hospital. And this is how we start working on that. In parallel, we have the head of department objectives, personal objectives related to that. But how to start the culture was in the other way, because they have the ideas of how to improve. That little things that are so important, because we from the top, we can put, as I said, like a photovoltaic cover, or we can take all the plastic out of the medication waste. But the ideas, the little ideas, they came from the bottom, and it's really important to engage them.
Yeah.
This is how we put water fountains, how we put a lot of improvements in the informatical improvements to reduce the print of paper. A lot of projects related to that.
So it seems you're really proud of actually the achievements that you were able to get through the
but
project.
it's not mine.
No,
it's like
right.
the thing is that it's like a snowball. When you start and you see that your colleague doesn't print it, you don't print, and it's like.
And the question is, you do also have now people knocking at the door say, I want to work in your hospital, because
some of them, yes.
Yeah,
it's
so
like a kind of mark of the
attractivity?
hospital. When you see Hospital de Mollet in Barcelona, you know that we are a green hospital.
Because I got 3 children who are almost ready for going to work, and I think actually if they have to choose, they want to look for a green hospital rather than any other hospital. They want to see the green word. Yeah.
I don't know if it's for everyone, because not everyone is so aligned with that objective.
Obviously not, right.
But it's
Someone
easier,
wants money,
it's
right?
easier for our institution that if people came, they are related to that kind of view.
And another question is, did you need to have a huge investment to do this in terms of financial resources?
Yes.
Or it was basically, I mean, what is the balance between it? Yeah.
I have sorry, I don't put the slide of all the graphs with the results, because we have all really measured.
Yeah.
And at first, the hospital was new, so it was really a huge investment at first. But another peak in 2023 for the photovoltaic cover. But if you see the total evolution, it goes down, like CO2, like
so
water
now you're
consumption.
saving money.
Yeah, we are saving money, yes.
You're saving money by now.
I have another session on Friday, and I have the slide. Sorry, I can share it. On Friday, you will see it.
So it will be a very interesting case study to be presented.
Yes. And the point is that we not also doing that for reducing. We are also related to quality improvement. We are a FEFQM 600 plus. We are Joint Commission accredited. So everything I'm talking about, it's really measured, and we have a lot of indicators to show what I'm saying.
Thank you, Caroline. Again,
Yes.
using my perspective. What do you seems to happen in your system, in your hospital, but in the Stockholm region, if I understood that is a process going through the regions, it's the adoption of what in the business environment we will call a typical business planning approach, in which before you start producing products, you look at the targets, what the targets need, and then you write. No entrepreneurs actually will be so crazy to produce products or services which will not be bought by the market, right? But sometimes happens. You know? Sometimes say, I know I can produce this, and I try to market to the market what I can produce, but not necessarily that you're going to be successful. Actually, most of the times you're not successful. So, targets analysis, production planning, and then, and it really was striking the fact that starting from the planning, then you do the right sizing. How do you do the right sizing in your system? In my system, it would be mostly impossible to move even one doctor from one floor to the next floor, or like 30 meters away. So everything it's really complicated from that perspective. So I want to understand a little more about how you did it. And the second question is that was a cultural change in the system. So again, how did you move beyond the typical retention of solutions, the typical ways of approaching things, which usually is past-driven rather than future pull in your system?
Well, I think it helped us because we were on a burning platform, actually. And I think if you're supposed to drive change, it's better if both patients and staff are kind of uncomfortable, because we had problems. Otherwise, it's not that easy, I think, to drive sustainable change. But we saw the cues. We had but a few actually tragic patient cases. Patients waiting for too long, at least suffering in the queues. And also a lot of strain on the staff, because they had to work overtime. And when we tried to have this data-driven approach, and I agree with you, nowadays I work together with what I call computer persons. I'm a medical doctor myself, an anesthesiologist. But when I, kind of work together with those that are really good at analyzing data, for example, we could create together, because it's really good to look at data and have the facts, and then you can make a plan. So then we saw the queues, and the staff, they were kind of overwhelmed most of the time and tired, and we saw that we didn't use the resources that we had in a good way. And I think it started in the operating theaters, because that's kind of a complex kind of healthcare, the rooms, the equipment, all the competences. So if you don't plan together, you will have a lot of waste in your system. So that was, we had a burning platform. And one other thing that is really, really important is that you have, the highest leaders' support. And we had so much support even from the politicians, because we put a lot of efforts explaining this, because it's, we had to build trust, and we had to take another approach, actually. So a data-driven approach, so we can really see what is happening, not just feeling. I'm a medical staff myself. We have a lot of feelings. We're not that into data usually. I would say, at least not in Sweden. So data-driven approach, but then building trust and always seeking the how, not the goal, because we know what we have to do. At least in Sweden, we kind of argue about the goal. We have to stop to do that. But we have to, you know, engage a lot of competent staff managers in the how. So good leaders, sustainable good leaders, was really important to do this. And we are continuing. And I think that the change will be really sustainable when everybody feels that this is a good thing. I don't have to work this much overtime. You know, I can get home in time, and we don't have so much queue of patients waiting. So yeah, so we will go on with this.
It looks like you were able to achieve both organizational sustainability and personal sustainability, as I called it before, because the two things match together, right?
You have to combine
different
it.
ways of work. Right sizing help people, help the staff to work in a better condition in terms of size.
Yeah, and I want to comment also on the right sizing. You have to do that wisely, and that's why you have to, as a medical manager, you have to work together with the data persons, because you cannot, you know, just take a scrub nurse and move to another unit. It doesn't work like that. They have their competencies. You have to do it in a wise way.
But very last question, in unions, did they say anything in your system, or they are just quiet and...
No, they're not quiet.
I just wonder.
First, they were skeptical. Oh, will you, you know, drive us harder? We cannot do another patient. I think that we have this picture in the media, for example, that we do everything perfect. So if we supposed to do one more patient, then we will get really, really tired. But that's not the case, actually. We have a lot of waste. So first I was a bit skeptical, but we had a lot of conversations with them. And when you have to, you know, rearrange the schedules, for example, then you can, you know, do something good about it. So we had a lot of conversations, and now they're kind of happy.
Very good, thank you. Gabriela, back to you. Going back also to the changes that we just hear about, when you drive change, you can be much, I call it past pushed. So you're driven by the past, or you can try to be future pull, right? The majority of situation we live in our organization often if the past is driving, you have problems and you have to solve problems. Not you have opportunities and you try to, because most of the people are really worried about the fact that tomorrow they're going to work and problems will be there. Well, opportunity will come. So the question is, how did you train a cohort of leaders like you're trying to do in a system where you have plenty of problems on a daily basis to cope with, and at the same time you asking them to be visionary and look in the future. They can come to my class and say, look, this is really interesting, but look, tomorrow when I go back, I got queue of people and I have, so how do you, can you actually engage them really and making them understand that this is actually what they need to do actually. It's a kind of a hybrid role, right? Being present, but also very much projected into the future.
Yeah, I think that's the most difficult question you put it in this panel. Because it's not...
You have to wait for the one for Charlotte.
Okay. It's not only up to the manager, but also it's to the context, the authority. The authorities, they might know what to do, but they might not have the legal framework or the funds. So we try to train as many people as possible, because as my colleagues presented, you have to do this in a team, not train only the manager, but train also the team he's working with, in order to not have too much resistance from the ones around. So in this time we decided to train, we were most prone to the high-level management training, but now we have in our plans to train other people in the hospitals or in other medical institutions, because all of them have to work together and they should understand each other and to not have too much opposition. And then the leaders, we will not, we hope not to limit only to management, but to introduce new modules, because the manager should understand himself what is the change about. So that's why we try to do other courses such as innovation and digitalization in health, sustainable green hospitals, and of course to create some champions and to bring them to help us in our courses, because when a teacher is telling you what happens in other parts is different, but if you have a colleague of you who tells you what he implemented and what are the results, this might be a bit challenging, and you might want to replicate in your own institution.
Very good. Very good. Again, if I understood well, also you stress the importance of training not just the current leaders, but especially the next cohort, because those are the ones that really can step in and
yes. And sorry,
not being so upset. They certainly might be obsessed by the present, but not as much as the current leaders, and they can be actually, when they step in, they can be ready to help the transformation of the organization.
And
so we need to invest on them.
They now are required to attend the management course every 2 years. Right. So we'll keep getting in contact with our students.
Repetita iuvant. They used to say the letters. Okay. Thank you very much. Charlotte, back to you now. Well, you can obviously freely comment on what you just heard about these 3 experiences, but I also want to ask you, you said at a certain point, we need to build a living network. So if you can articulate a little more about this, because I think that could be, the point is that in my experience, managers are doing a great job, but because they do not have a voice within a strong voice within the system, the politicians often can obviously do the good and bad weather, whatever they want. I mean, they could, they're not so influential as they could be, because they're not strong enough as a network to be representative. So there's something that we could do in that directions, and eventually what could be the role of associations like UFA and EHMA.
Thank you. I thought it was a hard question. So, I'm a terrified
I'll give you the last one, so you get prepared for that. You said there are 3 things that make you insomnia. You say one of the 3. What are the other 2? You say you have other 2 things actually that don't make you sleep, or if I understood well, you said at the beginning, other than the antibiotics.
Yeah, okay. So I'll start with the 3. War is obviously one of them. I've got kids that are on age that they can be called to fight, and that's like really terrifies me. And yeah, hard to find the 3rd one. I've got a list. I'm a terrified woman, but I'm a woman with a plan. All right. So yeah, that's how I got. Actually, when I applied to UFA, I really thought they will not take me. I don't have a PhD. I've got a little bit atypical path. I've been doing lots of things, but like cheerleading, hey, health champions. And because I thought they would not take me, I put everything. Like, okay, you're doing great science, but you're not doing that great in translating it to policy. Let's do it better. And they say, yes, okay, we agree. So that was really, wow. You know, they took me to the ward. And the first thing is building networks. I created groups with others. And with ASFAIR, we're working on the, Pokemons. So we have UFA and ASFAIR, we're working on UFASFAIR. So create a shared database. So for instance, if you're a public health professional and you recognize as public health professional, you can feel the feeling of belonging. And instead of having a different app for all our conferences, we could share the same app. So you could connect with people and reconnect and don't enter your social networks every time you go to a conference. And then you could say, oh, okay, we met in this conference, but we don't even just met. We also said, I'm going to work on this Spanish example. That was really interesting. I want to know how much money they saved, because that will be the leading things that will make people change. Then I can come back to you. Did you find this money? Did you find this amount? Because right now I'm in a position, I've got a new director in my hospital, and they look green. I mean, they had cool shoes, they came in bike, it's my moment. And then I don't maybe remember everyone, but I remember I spoke with you, I remember we are on the same database, I can connect with you. Easy. LinkedIn is obviously one of our network. It's really easy, but then you have lots of other people. But how do we are active? And again, how do we make things that are simpler? We publish research. You publish research. I don't publish research. But how do we make very simple case study, like the 3 things I want to remind from your speech? Like the 3 essential things and the condition. Again, the condition that made them possible, because you cannot copy-paste. We did that in Healthy City Network. Not saying, oh, this city did an amazing thing. You know, like Amsterdam is a cycling city, let's do the same. In Marseille, you won't do what Amsterdam has done. But you can learn from the condition and the way that change behavior to do it, adapt it to a city that is like that, to a city that is much broader, or adapt the thing. But if you want to adapt, you need to have a one-to-one call and say, hey, how did you do it? Eventually, I really like what you say, visit, go and visit, feel the ground, visit with other people. Last thing, I think we're always forgetting how much health is at the core of society. This is why I'm always bringing back communities, community public health worker. We're sending them to get people to be vaccinated. We're sending them in slums. We're sending them for the mental health of kids right now. They are a network, but with no network. We don't know how to connect all these people together. Next crisis, we don't know how to call them. We should be able to call them, like a brigade of resilience. If I could in hand, have a call, a WhatsApp group, a signal is better for that, of all the people trained in public health, CPR, on mental health, primary health care, primary aid for youth people, all the people doing food advice in neighborhood, and say, okay, crisis is coming, we need you to support the communities, because big heating, no electricity, and they would be there. But for that, and that's my last point, we need competency development, continuous professional development. We need credits. We need to have a label that we would share with other NGOs and say, this is a pathway, and once you've been trained in once, you can get the badge. I don't know if EHMA, do you have credits if you attend the EHMA? No. Well, if you come to EPH conference, if you're a medical doctor, you get credits. You get CTS. If you're a public health professional from the field or for any other thing, you don't get the credit because they don't exist. If you're an engineer, you get that. If you're a seller, you get that. Public health, we don't have that. If we want to matter, we have to make ourselves matter. That answer?
The answer, yes, and brings us to the last questions before we conclude this plenary session, which is nice for you, still for you, Charlotte. And, the question, you mentioned in your answer and also in your presentation the importance of involving community and starting with the people. That brings me back to the idea of co-production, co-creation of services, and to the title of the session itself, from reactive to proactive. So from your experience, from your youth perspective, what could be done within health system and health organization to increase the capacity of system organization to engage people in co-create, co-produce, and be more even responsible for the way they approach their health? And what is the role of, obviously, of managers in all this?
Yeah, well, first give the responsibility back to them, so that we don't say, okay, you have to walk 10,000 steps a day. I mean, come on, how many of you actually walk 10,000 steps a day? And we're like giving so many advices top down. I mean, let's just be all human and sit together in a round, not telling them things. I think, yes, crisis is opportunity. Crisis, a moment that doesn't work, is an opportunity. And find your champions, community champions. For instance, the Rennes hospital, I don't know if they're here, one of the big sustainability change they did was because of a nurse in the pediatric sector. And from her big project, they actually changed lots of things and became actually quite famous about that. But it can be for the kids, it can be for the environment. Choose your opportunity, find the leader and give them share the power. And I don't know if there's a female thing. I mean, none of you take credit. You took credit for what you say. It was all about, we did it together. And I think that the first thing we need to stop doing, having this all thing like, I do that, you do that, and fighting over who is doing the best. Like, give ownership to communities and use what's there. And we don't have the same situation in all countries, but we have leaders everywhere, and sometimes we don't even know they are here. So break silo, go and have coffee with people, not in an amphitheater. Go and have coffee or kombucha. No alcohol, of course.
So that's a challenge for us managers, getting out of the towers and getting to the field and ride in the community and be more.
But that's not
more,
even a
right?
challenge. You have green spaces, just open, make a picnic. Like,
Right.
like get some music. You probably have people you probably have bands in your hospitals you don't even know about. Make a concert, a festival.
Exactly.
Just open the doors.
And this will be really the main action to make health systems sustainable, right? Because if people actually start to be responsible, then everything else will fall better in place. Kind of, okay. Thanks a lot. Thanks to Charlotte, thanks to Gabriela, thanks to Caroline, and thanks to Natalia. It was a pleasure, and I think this actually ends the plenary session. Next is? Okay. After the break, we got the focus sessions. Thank you again, and have a good conference, everyone, and a good stay in Rennes.